नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH Women's University, Jaipur. Today's topic is hemorrhoids. Definition: dilated or enlarged vein in the lower portion of the rectum or anus. These enlarged or engorged vein causes the hemorrhoids. They commonly result from increased venous pressure. Hemorrhoid is also known by name piles. Frequency: almost 10 million people affected by the hemorrhoids. The common age for affection of hemorrhoid is 45 to 65 years. Half of the adult experience hemorrhoids by age of 50. It is very common in pregnant females. Anatomy and classification of hemorrhoids. Right anterior or right posterior and right lateral position. These are the three positions where commonly hemorrhoids occur. First is right anterior, second is right posterior, and third is left lateral positions. Those originating above the dentate line are termed as internal hemorrhoids, and those originating below the dentate line are termed external hemorrhoids. So hemorrhoids are also divided into two parts, which are internal hemorrhoids originating above the dentate line and external hemorrhoids originating below the dentate line. There is a diagram showing external hemorrhoids and internal hemorrhoids. Engorgement of the venous, you can easily see the engorgement of veins here. The pectinate line, also known as dentate line, is a line which divides the upper two-third and lower third of the anal canal. So dentate or pectate line present in a anal canal, and it divide it into upper two-third part and lower one-third part. Here you can see dentate line dividing the anal canal, and above this dentate line the venous engorgement and hemorrhoids present called internal hemorrhoids, and below this line the hemorrhoids are called external hemorrhoids. Internal hemorrhoid disease or internal hemorrhoids are manifested by two main symptoms. First is painless bleeding, and second is protrusion. Pain is rare as they originate above dentate line. The most common and main symptom of internal hemorrhoids are painless bleeding. Now, internal hemorrhoid, most popular etiological theory states that hemorrhoids result from chronic straining at defecation. Continued straining causes engorgement and bleeding, as well as hemorrhoidal prolapse. So most important reason to develop a internal hemorrhoid is chronic straining at defecation, which will also occur due to chronic constipation, and constipation is known to be the most important cause for developing hemorrhoids. Due to chronic constipation, patient strains at defecation and it results into internal hemorrhoids. Classification on grades. According to grade classification, there are four different grades of hemorrhoid. First is hemorrhoids that only bleeds. This is when the hemorrhoids only bleed, it is known as first grade hemorrhoid. Now, second grade hemorrhoid prolapse and reduce spontaneously. The hemorrhoid prolapse in first trying when defecation, but again spontaneously they reduce. They called second grade hemorrhoids. Now, third grade hemorrhoids required replacement. The first in third grade hemorrhoids, the prolapse of hemorrhoid occur, but it does not reduce spontaneously, but it required mechanical aid to replace them. So it required replacement. That says third grade hemorrhoids. Fourth grade hemorrhoid permanently prolapsed and they do not go back into anal canal. These are internal hemorrhoids and grades of their hemorrhoid. This is first grade, no prolapse, just prominent blood vessels. This is grade 2, prolapsed upon bearing down but spontaneous reduction occurs. Grade 3, prolapse upon bearing down require manual reduction. And grade 4, prolapse with inability to be manually reduced. Now, causes of piles. First and most important cause is constipation. Second is diarrhea. Third is sitting or standing for long period of time during day. Fourth is obesity. Fifth is heavy lifting. And sixth is pregnancy. Now, clinical features of hemorrhoids. First is rectal bleeding. Bleeding is not always present, but in most of the cases, bleeding is present. The color of blood is bright red color. Painful bowel movement also occur. Due to the prolapse, there will be anal itching present. Rectal prolapse also presents. Sometimes there will be thrombus formation and sensation of something coming out of rectum is present in the patient. Patient sometimes complains that something is coming out of rectum and there is very uneasy feeling about it. He does not able to find out what is coming, but there is a sensation and it is a great symptom for diagnosing hemorrhoid. Now, microscopically, the hemorrhoids are thin-walled and dilated tortuous veins that are seen under the rectal mucosa, which is internal piles, or anal skin in external piles. So when in the microscopically seen the rectal mucosa, there will be thin walled dilated tortuous, and when it is seen in rectal mucosa, then it is internal piles, and when it is seen in anal skin, it is external piles. Secondary changes and complication that may occur includes thrombosis, hemorrhage, inflammation, scarring, and strangulation, that is prolapsed piles. This session is powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in comment box. Thank you.